We've been talking about it. This month is Cervical Cancer Awareness Month. You've been seeing the teal out there in recognition of this month. Jessica Jones with Women's Health Alliance of Mobile is in the studio now to remind us of the steps we can take to protect ourselves and our loved ones when it comes to cervical cancer. Thank you so much for stopping by.
Yes, thank you for having me.
And I want to start with the obvious question here. What is cervical cancer?
Yeah, so cervical cancer is cancerous cells of the cervix, which is the opening of the womb in female patients. We see about 12,000 cases per year, and unfortunately, even with treatment, we see about 4,000 deaths per year.
So what's the cause?
Most cervical cancer is caused by a virus called HPV, or human papillomavirus. It's considered very prevalent in the sense that it's the most common STD that we have at this time. We're expecting that 90% of men will be exposed to this virus throughout their life, and 80% of women.
So let's talk about the prevention tools. We've got some really good ones, and the first is to get that exam.
Absolutely. Well, actually, the first is vaccination. We are now recommending vaccine for both male and female patients between the ages of 12 to 26. You can even actually get it up to the age of 45, depending on if your doctor thinks you need it. And then we also recommend cervical cancer screening, which is a pap smear, and we typically recommend that between the ages of 21 to 65. We also have a specialized HPV test to see if you carry the virus, and we recommend starting that at the age of 30.
Okay. I want to talk about treatment, you know, because there has been a lot of advancement in terms of cancer treatments. What are you seeing for cervical cancer treatments?
Well, for treatment, the best treatment is always prevention. And if we catch this early enough, then the treatments out there for pre-cancer cells are almost 90% effective. And these are all things that our office offers as gynecologists, and our you know, suggested treatments are, you know, coming in, getting screening, finding out if you're at risk. Unfortunately, patients with lower immune systems and those that smoke will be slightly more at risk for these viruses progressing to cancer.
So this is the time to get people's attention and make sure that they're doing the right things. What else do you think they need to hear, to know, so that this message is, you know, really hits home?
I think that cervical cancer is, in my opinion, one of the only preventable cancers out there. And so if you follow your doctor's guidelines and come in regularly, and we're able to catch it early, this is something easily preventable. But there's also those types that are very rapidly progressing. And so if you have any concerns whatsoever, please contact your doctor, and we'll be happy to help.
All right, thank you so much. Great advice and reminders too, because we know the information, but sometimes, you know, with Christmas wrapping up and Mardi Gras coming up, it gets a little difficult.
It's nice to have reminders.
Yes, thank you so much for stopping by, and we'll be sure to get this information posted on our website so you can share it with someone you know. Look for it shortly after this newscast. Thank you again.
Thank you.